Being a hairstylist as well as a trichologist is like the best of both worlds. It's kind of in a sense like the doctor and nurse relationship. You have the nurse at the bedside getting a first-hand report on what's going on with that patient. As a hairstylist standing behind the chair, I get a first-hand report on what's going on with the hair and scalp. With trichology, it's like the doctor in a sense. We have to assess what the root cause of that issue may be and come up with a treatment plan to help you manage and treat that issue. So for me, being a hairstylist as well as a trichologist, it's the best of both worlds. So question number 14. Are there any non-surgical or advanced available like laser therapy or hair transplant? Okay, so I'm gonna read that again. So they're asking, are there any non-surgical treatments or advanced treatments available, such as laser therapy or transplant? Okay. That was really nice and clear. Yes. Okay. So, yes. All right. There are always new developments every year with certain conditions. And then there are staple developments and staple treatments for certain conditions. It all depends on the condition, right? So I went over a few conditions, right? Female pattern or male pattern hair loss. This is one of the most common forms of hair loss suffered by people worldwide, right? Because it's a genetic predisposition, usually it's passed down through generation to generation. It doesn't mean it's going to surface, right? You can, like I have it, and my brother behind me has it, but I don't see it in my other brothers right behind us. So it skips generations sometimes as well, right? Um, so it depends because it's a genetic form. It's very common, right? Also, alopecia areata is a genetic predisposition as well. So that is like the second most common hair loss suffered worldwide. But there are systemic treatments, right? Where you have enzyme blockers, androgen blockers. You have topicals such as Rogaine, and now people believe rosemary oil, was going to do it. However, there were some studies that showed there's some efficacy to that. You have laser therapy, and then ultimately, really should be the last resort after you tried everything else, hair transplant. Hair transplant is really like the cosmetic form of it. However, I believe it's great because it's really excuse me necessary at times, and it's a confidence booster. You know what I mean? So, and if done well, it's really good. And it's like kind of permanent. So it's like you don't really lose the hair that's transplanted. Now, some people get them too soon. And what I mean by that is that you aren't ready to get this, especially if your hair loss, because genetic hair loss or female pattern, male pattern hair loss is progressive. So it usually starts an individual around 17 years old, sometimes sooner, and it progresses to about like 60s, but it's around that middle, like between like 25 and 35 is when you're really going to see the most progression, or evidence of this particular hair loss. And if you do the transplant, let's say 25, right? Right. Well, and say you're inconsistent with your treatments because there's maintenance treatments with these other systemic and topicals, right? Your hair loss is still progressing. So you may lose hair around the transplant and it looks like, what happened? My hair loss, my transplant didn't work. It's like, well, no, it did, but you didn't do the maintenance care to keep it at bay. So now you kind of need another one because you didn't do what you should have done. Exactly. Right? And a lot of places like Turkey, okay, you're flying to these places and they do a wonderful job. But sometimes what they do is they over harvest the donor area because you're coming so far. They're going to give you the best possible look and everything because you're coming so far, right? So they throw everything at you, right? And they do too many grafts. Well, now say it progresses, you need more grafts. You don't have anymore, or you have very, very few. So you've done the transplant surgery too soon, and did too much too soon, right? So alopecia areata, definitely systemic steroid injections is first line treatment. There's definitely immunosuppressants and things like that that you can take to help keep the immune system at bay and not attack the follicle system, and then topicals, right? Um, these are like traditional, but some topicals, there are new experimental topicals. I think there was one with like vitamin C or and vitamin D. I've seen some research done on that because it's like they're antioxidants. You're trying to counteract the inflammation, the oxidation, oxidative stress. So I get that, right? Right. And then we have something which is a wild card I want to throw in because it's not really common, but it is common amongst a subgroup of people, or I want to say a subgroup, a demographic of people, I'll say. Usually Black and brown people, or African American, or anyone of that, pigment that have or receive clipper cuts or razor shapes, right? It's something called dissecting cellulitis, right? And this is it presents itself like in swelling of the scalp, drainage, we're going fissure cracks, so where it's like it'll ooze like pus and drainage, things of that nature. But this right here is a hair loss that can become a permanent scarring hair loss, right? But if caught early, can be treated. But chances are, because there's a staph infection in the body, it can present itself over and over again. So it can be continuous. And there are new developments with the treatment, but most of the treatments is incision draining the sites where the pus is building. Keeping it clean, steroids, whether oral steroids or topical or both. And just keeping and not cutting the hair as close, right, in those areas, because sometimes it's like, well, it was like really so an infected follicle, and then that staph infection took over, and then it, got out of control. But that's one of those conditions that is like, is not talked about often with trichologists. We have female pattern hair loss, alopecia areata, traction alopecia. But sometimes we'll see someone with a hair loss that we're maybe not as familiar with. And, we still need to research and study, to see how that direct you. I'm definitely going to tell you to go to the doctors because you're going to need like surgical intervention with this because it's incision and drainage. And then you need medication to follow up to keep that, with antibiotics and steroids and things like that. Oh, perfect breakdown. I'm trying. Perfect. Oh, I tried. That was a good in-depth one. So that was question 14.